Hi, I will be answering questions for our final evaluation. The first one is, do I feel prepared for the rural foci? No, personally, I did not feel prepared for the rural foci because I was not accustomed to rural or team nursing where they share their patient load and they care for their patients together. This is because my last placement was in Medicine Hat in 5 East, where they usually were pretty independent with their own patients and they took care of their own patient loads. I could have felt more prepared if I was introduced to team nursing more and had some more experience with it during clinical. What went well in your rural practicum placement? What went well in my rural practicum placement was the relationships, our professional relationships that I built with the staff there and my mentor. They were really supportive. They guided me on a lot of things and they gave me a lot of tips. The greatest learning event or situation that took place would be the first 2 childbirths that I witnessed. This is because we don't have much experience with a childbirth or labor and delivery, and this was kind of my first step in, so that was a really interesting experience. The greatest challenge in the rural foci would be working as a team. This was difficult for me because I was not used to kind of sharing patient load and having someone else administer my medications for me. I was used to doing them myself, and this kind of messed up the routine that I was accustomed to back in Medicine Hat, so adjusting to this was difficult. What did I learn from this challenge? I learned how to communicate with my coworkers or colleagues and to sort of open that communication to provide the best patient care. Do I feel supported by my mentor and faculty advisor? Personally, I felt really supported with my mentor and faculty advisor. They were always there to answer any questions I had, and they were always kind of that one call away. And they made me feel really comfortable and confident with my knowledge and my skills. What could have been done differently if not? The only thing that could have done differently in my time in the Brooks Health Center would be I would have loved to be introduced to other units such as Emerge and more in labor and delivery. I feel like learning the routine in those units would be really beneficial to my learning. How has this experience impacted your nursing practice going forward into final preceptorship and beyond? This experience has impacted my nursing practice going forward because I believe that it offered a really good foundation with my knowledge and skills in Med-Surg. I was able to care for a lot of patients from a young age to older adults, and there were a lot of different cases that I could learn from. And I believe settling into the routine and communicating with my coworkers also helped a lot. Yeah. And going to beyond, I believe that this set me up with a real world nursing as well. I was able to deal with a lot of families, a lot of different personalities, where sometimes families are also distressed, and I was able to learn how to de-escalate situations and sort of communicate with a family based on what the patient is going through and what the patient needs at the time. Overall, it was a really good experience. that I had in Brooks Rural Health, and everyone has been really supportive, and I would not have changed anything.